The morning fog rolled across the training compound at Naval Amphibious Base Coronado like a gray blanket, muffling the sounds of preparation that echoed from the barracks. Sarah Martinez adjusted her gear for what felt like the 100th time, her hands trembling slightly as she checked each piece of equipment. At 24, she was one of only 3 women in the elite maritime special operations training program, a fact that seemed to follow her like a shadow wherever she went. The bruise on her left shoulder had deepened to a dark purple overnight, a reminder of yesterday's hand-to-hand combat session where she had been paired with Rodriguez, a mountain of a man who showed no mercy regardless of gender. Sarah appreciated that approach. Even if her body didn't always agree, she had fought tooth and nail to earn her place here, and the last thing she wanted was special treatment. Chief Petty Officer Marcus Thompson stood at the front of the formation, his weathered face scanning the 22 trainees who remained from the original 43. The dropout rate was intentionally brutal, designed to weed out anyone who lacked the mental fortitude and physical resilience required for the most demanding military operations in the world. Thompson had seen hundreds of hopefuls come through these gates over his 15-year career as a SEAL medic and instructor. Few surprised him anymore. But Martinez was different. She never complained, never asked for help, and never gave less than everything she had. What concerned Thompson wasn't her performance, which consistently ranked in the top 5 of her class. What worried him was the way she isolated herself, the way she seemed to carry weight beyond the physical demands of training. As the senior medical instructor, he had learned to read people, to spot the signs of stress and trauma that could compromise a mission or endanger lives. The morning briefing began with a review of the previous day's underwater navigation exercise. 3 trainees had failed to complete the course within the required time parameters and were quietly removed from the program. No fanfare, no dramatic speeches. They simply received their orders to report to their new assignments and disappeared from the compound. This was the way of special operations training, where failure was measured in seconds and margins for error didn't exist. Sarah listened intently as Thompson outlined the day's medical training scenario. They would be conducting advanced trauma care under simulated combat conditions, complete with smoke, loud noises, and time pressure designed to mimic battlefield stress. Each trainee would rotate through roles as medic, patient, and security, with instructors evaluating their performance at every step. The training began at the mock village constructed on the eastern edge of the base. The scenario involved a team insertion gone wrong, with multiple casualties requiring immediate medical attention while under enemy fire. Sarah found herself paired with Jackson, a former Army Ranger whose cocky attitude had rubbed her the wrong way since day 1 of training. As they moved through the simulated urban environment, smoke grenades exploded around them, while blank ammunition created a deafening cacophony. Thompson observed from his elevated position, noting how each trainee responded to the chaos. Some froze momentarily before finding their rhythm. Others moved with practiced efficiency, their previous military experience evident in their fluid movements. But Martinez moved differently than the others. Her actions were precise and controlled. But there was something rigid about her posture, something that suggested she was fighting more than just the training scenario. When the first simulated casualty was discovered, Sarah immediately took charge of the medical response. The mannequin was configured to simulate multiple gunshot wounds and severe blood loss. Working with mechanical precision, she established an airway, controlled bleeding, and prepared the patient for evacuation, while Jackson provided security. Her technique was flawless, her speed impressive. But Thompson noticed something that made him frown. She was holding her breath, working in short bursts rather than maintaining steady respiration under stress. The second phase of the exercise required the teams to extract their casualties while moving through a gauntlet of simulated enemy positions. Sarah lifted the 180-pound training dummy onto her shoulders in a fireman's carry, her smaller frame struggling with the weight. Jackson moved to assist, but she sharply waved him off, her voice cutting through the noise with an intensity that caught Thompson's attention. As they moved through the extraction route, Sarah stumbled twice, her legs shaking under the combined weight of her gear and the casualty. Her breathing became labored, and Thompson could see her face flushing with exertion. Still, she pressed forward, determination etched in every line of her body. When Jackson again offered to share the load, Her response was sharp enough to make the other trainees step back. The final phase took place at the medical station, where trainees had to perform advanced procedures under continued pressure. Sarah's hands, usually steady as stone, showed the slightest tremor as she worked to establish an IV line on a training arm while explosions continued to rock the area around them. Thompson moved closer, positioning himself where he could observe her technique while remaining unobtrusive. What he saw confirmed his growing concerns. Sarah was competent, even exceptional in her medical skills, but she was operating on pure willpower rather than the controlled aggression that characterized the best special operations personnel. She was fighting herself as much as she was fighting the training scenarios, and that internal battle was beginning to show cracks in her otherwise impressive performance. When the exercise concluded, the trainees gathered for the immediate after-action review. Thompson praised the group's overall performance while noting specific areas for improvement. Several trainees received individual feedback, both positive and corrective. When his gaze fell on Sarah, she stood at rigid attention, waiting for his assessment. Thompson's evaluation was brief but pointed. Her medical skills were exemplary, her leadership under pressure noteworthy. However, he noted opportunities for improvement in team dynamics and load sharing during casualty evacuation. The words were professional and measured, but Sarah heard something else in his tone, a suggestion that he had observed more than just her tactical performance. As the group dispersed for chow, Thompson called out to Sarah. She approached with the same rigid posture she maintained during formation, her face revealing nothing of whatever thoughts occupied her mind. Thompson had dealt with enough struggling trainees to recognize the signs, but Martinez presented a unique challenge. She wasn't failing in any measurable way, but something was clearly affecting her ability to function at full capacity. Their conversation was brief and professional. Thompson inquired about her recovery from the previous day's training, noting the visible bruising on her shoulder and arms. Sarah's responses were textbook perfect, acknowledging minor soreness while insisting it had no impact on her performance capability. Thompson probed gently about her adaptation to the training environment and her interactions with other team members. Again, her answers were precisely what regulations required, but they revealed nothing about the person behind the uniform. Thompson dismissed her with instructions to report for additional medical training that evening. As she walked away, he made a mental note to pay closer attention to Martinez in the coming days. Something wasn't right. And in his experience, unresolved issues had a way of surfacing at the worst possible moments. In special operations, those moments could mean the difference between mission success and catastrophic failure. Sarah spent her lunch break alone, as had become her habit. She chose a spot overlooking the Pacific Ocean, where the constant sound of waves provided a backdrop for her thoughts. The bruises covering her arms and torso were reminders of the physical demands she faced daily, but they were nothing compared to the invisible weight she carried. Every interaction with her male teammates required careful calculation, every response measured to avoid appearing weak or overly aggressive. The afternoon brought weapons training and small unit tactics, subjects where Sarah excelled. Her marksmanship scores consistently ranked in the top 3 of her class, and her understanding of tactical movement impressed even the most experienced instructors. Yet even here, she maintained the same rigid control that Thompson had observed during medical training. She never celebrated successful shots, never showed frustration with minor errors, and never engaged in the casual banter that helped bond military units. As evening approached and the other trainees headed to the recreation area, Sarah made her way to the medical training facility for the additional instruction Thompson had ordered. She arrived precisely on time, her gear properly arranged, and her uniform immaculate despite the day's demanding activities. Thompson was waiting, his expression neutral as he gestured for her to enter the training bay. The facility was equipped with state-of-the-art medical simulation equipment, capable of replicating virtually any trauma scenario that special operations personnel might encounter in the field. Thompson had selected a complex case involving multiple trauma patients with varying degrees of injury severity. The scenario would test not just medical skills, but decision-making under pressure and the ability to prioritize resources effectively. As Sarah began working through the simulation, Thompson observed her with the practiced eye of someone who had trained countless medics. Her technical proficiency was undeniable. Her knowledge of trauma medicine impressive for someone her age. But the same rigid control that characterized all her actions was evident here as well. She worked with mechanical precision, following protocols perfectly but showing little of the adaptive thinking that separated good medics from exceptional ones. Thompson introduced complications into the scenario, simulating equipment failures and changing patient conditions that required immediate adjustments to treatment plans. Sarah adapted competently, but her responses suggested she was working from memory rather than intuition. When he added time pressure and environmental stressors, the cracks in her composure became more apparent. Her breathing became shallow, her movements slightly less coordinated, though she continued to perform within acceptable parameters. After the simulation ended, Thompson initiated a debrief session. His questions were designed to explore not just what Sarah had done, but why she had made specific decisions and how she had processed the stress of the scenario. Her answers were textbook accurate, but revealed little about her thought processes or emotional state during the exercise. Thompson shifted his approach, asking about her background and motivation for pursuing special operations training. Sarah's biography was impressive. Top of her class in hospital corpsman school, decorated service in field medical units, multiple deployments to combat zones. Yet when she spoke about her experiences, there was a detachment in her voice that suggested unresolved trauma or emotional suppression. The conversation continued for nearly an hour, with Thompson probing gently but persistently about Sarah's adaptation to the training environment. He had dealt with enough post-traumatic stress cases to recognize the signs. But Sarah's presentation was unusual. Rather than the typical symptoms of PTSD, she displayed what psychologists called emotional numbing, a protective mechanism that allowed her to function but prevented her from processing traumatic experiences fully. As their session concluded, Thompson made a decision that would alter the trajectory of Sarah's training. Rather than filing a standard evaluation report, he requested a private consultation with the training command's senior psychologist. Sarah's technical competence was beyond question, but her emotional state represented a potential liability that needed to be addressed before she could progress to more advanced phases of training. Sarah left the medical facility with mixed feelings about the extended session with Thompson. His questions had probed areas she preferred to keep buried, touching on memories and experiences she had worked hard to compartmentalize. The additional training had been challenging but manageable, yet she sensed that Thompson's interest went beyond her medical capabilities. His attention felt both supportive and threatening, representing the possibility of help she was afraid to accept and scrutiny she was determined to avoid. The consultation with Dr. Patricia Hawkins took place 3 days after Thompson's extended training session with Sarah. Dr. Hawkins had spent 12 years working with special operations personnel, developing expertise in the unique psychological challenges faced by elite military units. Her office, located in a nondescript building near the main administrative complex, was designed to feel more like a comfortable living room than a clinical setting. The carefully chosen decor and ambient lighting were intended to encourage openness, though many of her patients remained guarded regardless of the environment. Thompson briefed Dr. Hawkins on his observations of Sarah's performance and behavior patterns. He described her exceptional technical competence, coupled with what he characterized as emotional rigidity and social isolation. While Sarah had committed no infractions and maintained excellent performance standards, Thompson's experienced eye detected warning signs that concerned him. In special operations, one day there, psychological stability was as critical as physical capability, and unresolved trauma had a way of surfacing at the worst possible moments. Dr. Hawkins reviewed Sarah's service record and psychological evaluation reports from her previous assignments. The documentation painted a picture of an exemplary service member who had performed admirably in challenging circumstances. However, several incidents mentioned in her file caught the psychologist's attention. During her deployment to Afghanistan, Sarah had been involved in a medical response to a vehicle-borne, improvised explosive device attack that resulted in multiple casualties. Her after-action report was thorough and professional, but the psychological evaluation conducted afterward noted signs of emotional suppression and difficulty processing the traumatic experience. Additional reports from her time with a forward surgical team described Sarah as competent but increasingly isolated from her peers. Colleagues praised her medical skills while noting her reluctance to participate in recreational activities or informal social interactions. Her supervisors had attributed this behavior to the stress of deployment and the demands of her position. But Dr. Hawkins recognized patterns that suggested deeper psychological concerns. The decision was made to conduct a comprehensive psychological evaluation, framed as a routine assessment rather than a response to specific concerns. This approach was designed to avoid making Sarah feel singled out, while allowing Dr. Hawkins to explore areas of concern identified by Thompson. The evaluation would include standardized psychological testing, clinical interviews, and observational assessments designed to identify potential issues that might affect Sarah's performance or safety. Sarah received notification of her scheduled evaluation through routine administrative channels, along with several other trainees who were undergoing similar assessments. The timing was presented as part of the normal progression through training phases, though Sarah's analytical mind recognized that her recent individual attention from Thompson might be related to the sudden scheduling. Nevertheless, she approached the evaluation with the same methodical preparation she applied to all aspects of her training. The initial session with Dr. Hawkins focused on establishing rapport and gathering background information about Sarah's military service and personal history. Dr. Hawkins employed a conversational approach, asking open-ended questions about Sarah's motivation for military service and her career aspirations. Sarah's responses were articulate and well-reasoned, describing her desire to serve in the most challenging environments where her medical skills could make the greatest difference. When the conversation turned to her deployment experiences, Sarah provided detailed accounts of her duties and responsibilities, while carefully avoiding emotional content. She described treating wounded service members and civilians with clinical precision, focusing on medical procedures and outcomes rather than the human cost of the injuries she had treated. Dr. Hawkins noted this pattern of emotional detachment, recognizing it as a coping mechanism that allowed Sarah to function in traumatic environments but might prevent her from processing those experiences in a healthy way. The psychological testing phase revealed interesting contradictions in Sarah's personality profile. Her cognitive abilities tested in the superior range, with particular strengths in spatial reasoning and processing speed that made her well-suited for high-pressure decision-making scenarios. However, her emotional intelligence scores suggested difficulty recognizing and expressing emotions, both in herself and others. This pattern was consistent with individuals who had experienced significant trauma and developed protective mechanisms to avoid emotional vulnerability. During the clinical interview portion of the evaluation, Dr. Hawkins explored Sarah's family background and early life experiences. Sarah described growing up in a military family where emotional expression was discouraged and personal strength was measured by the ability to endure hardship without complaint. Her father, a career Marine, had instilled values of duty, honor, and self-reliance that shaped Sarah's approach to challenges throughout her life. While these values served her well in military environments, they also contributed to her reluctance to seek help or acknowledge emotional distress. The conversation eventually touched on Sarah's experiences as one of the few women in male-dominated military specialties. Sarah acknowledged the additional scrutiny she faced while downplaying any impact on her performance or well-being. She described incidents of harassment and discrimination with the same clinical detachment she applied to other difficult experiences, treating them as obstacles to overcome rather than sources of ongoing stress or trauma. Dr. Hawkins recognized that Sarah had developed highly effective coping mechanisms that allowed her to function in challenging environments, but these same mechanisms might prevent her from forming the trust and emotional connections essential for special operations teamwork. The bonds formed between team members in elite units often meant the difference between life and death, and Sarah's emotional barriers could potentially compromise not just her own safety but that of her teammates as well. Meanwhile, Thompson continued monitoring Sarah's progress in regular training activities. Her performance remained consistently excellent, but he noticed subtle changes in her interactions with other trainees. During team exercises, she fulfilled her responsibilities competently but showed little of the camaraderie that typically developed among trainees facing shared hardships. Her communications were professional but minimal, and she seemed to actively avoid the informal interactions that helped build trust within military units. The breakthrough came during a particularly challenging survival training exercise conducted in the mountains east of San Diego. Teams of 4 trainees were inserted into remote terrain with minimal equipment and tasked with reaching designated extraction points while avoiding capture by opposing forces. The exercise was designed to test not just survival skills, but leadership, teamwork, and the ability to function effectively under extreme stress. Sarah found herself team leader for the exercise, paired with Jackson, Rodriguez, and a newer trainee named Peters, who had joined the program after completing Marine Force reconnaissance training. The team dynamics were complicated by Jackson's resentment at being led by a woman and Peters' inexperience with the specific protocols of SEAL training. Rodriguez, the most experienced team member, maintained a professional but distant relationship with Sarah that reflected the broader challenges she faced in gaining acceptance from her male counterparts. The first day of the exercise proceeded smoothly, with Sarah's navigation skills and tactical planning keeping the team ahead of schedule toward their first checkpoint. Her leadership style was methodical and thorough, ensuring that each team member understood their responsibilities while maintaining operational security. However, the emotional distance she maintained from her teammates began creating friction as the stress of the exercise intensified. On the second day, Peters suffered a severe ankle injury while crossing a rocky stream bed. The injury wasn't life-threatening, but it significantly compromised his mobility and threatened the team's ability to reach their extraction point on schedule. The situation required immediate medical attention followed by difficult decisions about how to proceed with a compromised team member. Sarah's response to the medical emergency was swift and professional. She immediately assessed Peters' condition, determined that he had suffered a severe sprain rather than a fracture, and implemented appropriate treatment to reduce swelling and provide pain relief. Her medical skills were evident in the speed and precision of her care, but her emotional response to Peters' obvious distress revealed the limitations of her coping mechanisms. While treating Peters' injury, Sarah maintained complete focus on the medical aspects of the situation while seeming oblivious to his emotional state. Peters, a tough Marine who rarely showed weakness, was clearly struggling not just with pain but with frustration and concern about letting his team down. Sarah provided excellent medical care while offering no emotional support or reassurance, treating Peters more like a casualty to be managed than a teammate facing a difficult situation. The team's subsequent discussions about how to proceed revealed deeper issues with Sarah's leadership approach. Jackson argued for leaving Peters at a safe location, while the rest of the team continued to the extraction point, a tactically sound decision that would maximize their chances of mission success. Rodriguez suggested modifying their route to accommodate Peters' limited mobility, accepting increased risk and reduced speed in exchange for maintaining team integrity. Sarah's response reflected her training and personality, focusing on tactical considerations while avoiding the emotional dimensions of the decision. She analyzed each option methodically, weighing factors like time constraints, terrain challenges, and enemy activity patterns. Her analysis was thorough and logical, but it failed to address the human elements that made such decisions so difficult. Peters' input was sought regarding his assessment of his own capabilities, but Sarah showed no recognition of his emotional investment in the team's success. The decision ultimately made was a compromise that reflected Sarah's analytical approach more than inspired leadership. The team would continue toward the extraction point with modifications to accommodate Peters' injury, but they would implement aggressive operational security measures to minimize detection by opposing forces. It was a reasonable solution that balanced competing priorities, but it lacked the emotional resonance that might have truly unified the team behind a common purpose. As the exercise continued, the physical and emotional stress began taking a toll on all team members. Sleep deprivation, limited food, and constant vigilance created conditions that tested psychological resilience as much as physical endurance. Sarah maintained her characteristic control and competence, but the other team members began showing signs of frustration with her leadership style. Jackson became increasingly vocal in his criticism of decisions he viewed as overly cautious, while Rodriguez withdrew into professional compliance, without the enthusiastic cooperation that characterized effective teams. The crisis came on the final day of the exercise, when the team was detected by opposing forces just hours before their scheduled extraction. The situation required immediate action to evade capture while maintaining their timeline to reach the pickup point. Sarah's initial response was to implement a pre-planned evasion route that would minimize contact with opposing forces while ensuring they reached the extraction point on schedule. However, Jackson challenged her decision, arguing for a more aggressive approach that would eliminate the pursuing forces and allow the team to proceed without further interference. His proposal was tactically sound but carried significantly higher risk, reflecting his frustration with what he perceived as Sarah's overly conservative leadership. The argument that followed revealed not just tactical disagreements but deeper tensions about authority, competence, and gender dynamics within the team. Sarah's response to the challenge was characteristic of her approach to conflict throughout training. She acknowledged Jackson's concerns while firmly maintaining her decision, citing regulatory guidelines and risk assessment protocols that supported her chosen course of action. Her arguments were logical and well supported, but they failed to address the emotional undercurrents of Jackson's challenge or the broader team dynamics that his outburst had revealed. The team proceeded with Sarah's plan, successfully evading capture and reaching the extraction point within the required time frame. From a tactical perspective, the exercise was a complete success, with all objectives achieved and all team members safely extracted. However, the post-exercise debriefing revealed significant concerns about team cohesion and leadership effectiveness that went beyond simple tactical execution. The debriefing session following the survival exercise took place in a sterile conference room where fluorescent lights cast harsh shadows across the faces of the 4 team members. Thompson sat at the head of the table with 2 other instructors, their expressions neutral as they prepared to dissect every aspect of the team's performance. The standard protocol required each team member to provide their assessment of the exercise, focusing on tactical execution, leadership decisions, and team dynamics. Sarah presented her after-action report with characteristic precision, outlining their route selection, timeline management, and successful completion of all assigned objectives. Her analysis was thorough and professional, noting areas where performance could be improved while highlighting tactical successes that demonstrated effective planning and execution. However, her report conspicuously avoided any mention of the interpersonal conflicts that had marked the final day of the exercise. Jackson's report told a different story. While acknowledging the team's tactical success, he raised concerns about leadership decisions that he characterized as overly risk-averse and lacking in decisive action. His criticism was carefully worded to avoid direct insubordination, but the underlying message was clear. He questioned Sarah's ability to make the hard choices required in combat situations. His comments reflected not just disagreement with specific decisions, but broader doubts about her suitability for special operations leadership. Rodriguez provided a more diplomatic assessment that nevertheless echoed some of Jackson's concerns. He praised Sarah's medical skills and tactical knowledge, while noting opportunities for improvement in team communication and decision-making processes. His professional tone couldn't entirely mask his observation that the team had functioned more like a collection of individuals than a cohesive unit working toward common objectives. Peters, despite his injury and limited experience, offered perhaps the most insightful perspective. He acknowledged his own limitations during the exercise while noting that the team had never quite gelled in the way he had experienced with other military units. His comments suggested that while individual competence was high, the emotional connections that transformed groups into teams had never fully developed. Thompson's evaluation focused on tactical execution and mission accomplishment, areas where the team had performed admirably. However, his experienced eye had observed the interpersonal dynamics that concerned him about Sarah's development as a leader. The same emotional distance that protected her from trauma also prevented her from connecting with teammates in ways that fostered trust and loyalty. In special operations, where personnel often operated in small, isolated units under extreme stress, these connections could mean the difference between mission success and catastrophic failure. Dr. Hawkins received a detailed briefing on the exercise outcomes and team dynamics, information that provided crucial context for her ongoing evaluation of Sarah's psychological state. The patterns observed during the survival exercise confirmed her assessment that Sarah had developed coping mechanisms that allowed her to function effectively as an individual performer, but limited her ability to lead and inspire others. The challenge was determining whether these patterns could be modified through targeted intervention or represented fundamental limitations that would prevent her from succeeding in special operations roles. The psychological evaluation continued, with more intensive sessions designed to explore the roots of Sarah's emotional detachment and assess her potential for change. Dr. Hawkins employed various therapeutic techniques to help Sarah recognize and articulate emotions that she had learned to suppress. The process was challenging for someone whose survival had depended on maintaining emotional control, but it began revealing the experiences that had shaped her protective mechanisms. Sarah's childhood had been marked by constant relocations as her Marine father advanced through the ranks, creating a pattern of temporary relationships that never had time to deepen into lasting connections. Her mother, struggling with depression and alcohol abuse, had been emotionally unavailable during critical developmental years, forcing Sarah to become self-reliant at an early age. These experiences had taught her that emotional vulnerability led to disappointment and pain, lessons that served her well in military environments, but limited her capacity for the deep trust required in special operations teams. Her deployment experiences had reinforced these patterns, particularly a traumatic incident in Afghanistan that she had never fully processed. While serving with a forward surgical team, Sarah had treated a young Afghan girl who had been severely injured in a Taliban bombing attack. Despite Sarah's best efforts, the child had died during surgery, an outcome that haunted Sarah despite the professional recognition that she had done everything possible to save the girl's life. The incident had crystallized her belief that emotional distance was necessary protection against the inevitable pain of losing people she cared about. Dr. Hawkins recognized that Sarah's coping mechanisms, while problematic for team dynamics, had allowed her to function effectively in traumatic environments where many others might have broken down completely. The challenge was helping her develop the emotional flexibility to connect with teammates while maintaining the resilience that had made her an exceptional medic and service member. This would require not just therapeutic intervention but fundamental changes in how Sarah approached relationships and vulnerability. Thompson, meanwhile, faced his own dilemma regarding Sarah's future in the program. Her technical competence was undeniable, and her determination and work ethic were exemplary. However, the leadership challenges revealed during the survival exercise raised questions about her suitability for special operations roles that required not just individual excellence, but the ability to inspire and lead others under extreme circumstances. The decision about her future would need to balance her obvious potential against realistic assessments of her current limitations. The turning point came during a night training exercise designed to simulate a hostage rescue operation. Sarah found herself assigned as the medical team leader, responsible for treating casualties while coordinating with assault teams operating in a complex urban environment. The scenario was deliberately chaotic, with multiple casualties requiring simultaneous treatment and evacuation, while hostile forces continued to threaten the operation. As Sarah worked to stabilize the most critically injured casualty, a training mannequin configured to simulate severe blood loss and airway compromise, she became aware of real distress from one of the role players. Petty Officer Williams, an experienced SEAL who was simulating a minor injury, was having what appeared to be a panic attack triggered by the realistic blood effects and chaotic environment. His breathing was rapid and shallow, his face pale with sweat, and his hands were shaking in a way that had nothing to do with his simulated injuries. For a moment, Sarah faced a choice that crystallized all of her training and personal struggles. Her instinct was to focus on the simulated casualty, completing the training exercise according to established protocols, while leaving Williams' distress for others to address. This approach would be professionally appropriate and personally safe, avoiding the emotional vulnerability that came with recognizing and responding to genuine human suffering. Instead, Sarah made a decision that surprised everyone, including herself. She immediately shifted her attention from the mannequin to Williams, recognizing that his panic attack represented a real medical emergency that took precedence over training objectives. Her response was swift and compassionate, using both her medical skills and emotional intelligence to help Williams regain control of his breathing and heart rate. She spoke to him calmly and directly, acknowledging his distress while providing practical guidance for managing his anxiety response. The moment lasted only a few minutes, but its impact rippled through the training exercise and beyond. Other trainees observed Sarah's response with surprise and respect, recognizing that she had prioritized human need over performance metrics in a way that demonstrated true leadership. Williams, a respected veteran with multiple combat deployments, later expressed gratitude not just for Sarah's medical intervention, but for her recognition of his humanity in a moment of vulnerability. Thompson witnessed the incident from his observation post, and what he saw fundamentally changed his assessment of Sarah's potential. For the first time since he had begun observing her, Sarah had acted from genuine emotion rather than programmed response. Her decision to prioritize Williams' real distress over simulated casualties demonstrated the kind of moral courage and emotional intelligence that distinguished great leaders from merely competent ones. Dr. Hawkins learned about the incident during her next session with Sarah, and she immediately recognized its significance. For the first time, Sarah had voluntarily chosen emotional engagement over self-protection, demonstrating that her capacity for empathy and connection existed despite years of suppression. The incident provided a foundation for exploring how Sarah might develop these capabilities more consistently, while maintaining the psychological resilience that made her effective in challenging environments. The conversation that followed was different from their previous sessions. Sarah spoke about Williams' panic attack with genuine concern and emotion, describing how his distress had reminded her of her own struggles during deployment. For the first time, she acknowledged the emotional cost of the detachment she had cultivated, recognizing that her protective mechanisms had isolated her from both pain and joy, from both trauma and healing. The breakthrough continued as Sarah began exploring memories and experiences she had avoided for years. She talked about the Afghan girl whose death had haunted her, finally allowing herself to grieve not just for the child, but for all the connections she had avoided out of fear of future loss. The process was painful but necessary, helping Sarah understand that emotional vulnerability was not weakness, but strength, and that true resilience came not from avoiding pain, but from processing it in healthy ways. Thompson made the decision to recommend Sarah for continuation in the program, but with conditions that reflected both her potential and her ongoing development needs. She would receive additional leadership training focused on team dynamics and emotional intelligence, while continuing her work with Dr. Hawkins to develop healthier coping mechanisms. The recommendation acknowledged that Sarah's journey was far from complete, but recognized that her recent breakthrough demonstrated capacity for the growth required for special operations leadership. The final phase of training presented new challenges that tested Sarah's evolving emotional intelligence alongside her technical skills. She found herself leading teams in scenarios that required not just tactical expertise, but the ability to inspire others and maintain morale under extreme stress. Her approach began incorporating the emotional awareness she was developing through therapy, resulting in more effective leadership and stronger team cohesion. Her relationship with fellow trainees evolved as well. Jackson, initially skeptical of her capabilities, began respecting her ability to balance tactical acumen with genuine concern for team members. Rodriguez found himself drawn into more personal conversations with Sarah as she became more emotionally available. Even Peters, despite his earlier injury, sought her guidance on both professional and personal matters, recognizing that her combination of competence and emerging empathy made her a valuable mentor. The program's culminating exercise was a complex multi-day operation that combined all elements of special operations training: insertion via multiple platforms, reconnaissance and surveillance, direct action against defended targets, and extraction under pressure. Sarah served as the overall medical coordinator, responsible for ensuring casualty care capabilities throughout the operation while maintaining medical readiness for potential real emergencies. Her performance during this final test demonstrated how far she had progressed since the beginning of training. While maintaining her characteristic technical excellence, she now brought emotional intelligence and genuine caring to her leadership role. She anticipated team members' needs, provided encouragement during difficult moments, and made decisions that balanced tactical requirements with concern for personnel welfare. Most importantly, she had learned to accept help and support from others, recognizing that vulnerability could be a source of strength rather than weakness. The graduation ceremony took place on a perfect California morning, with families and commanders gathered to recognize the achievement of the 18 trainees who had completed the program. Sarah stood in formation with her classmates, no longer the isolated individual who had begun training months earlier. The bruises that had once been symbols of her determination to endure anything alone had been replaced by the confident bearing of someone who had learned that true strength came from connection rather than isolation. Thompson watched the ceremony with satisfaction, knowing that Sarah's journey represented one of the most challenging and rewarding development cases of his career. She had entered the program as an exceptional individual performer, but was leaving as a leader capable of inspiring and caring for others. The transformation hadn't been easy, requiring confrontation with deeply held beliefs and painful memories, but the result was someone who could serve effectively in the most demanding military environments while maintaining her humanity and emotional health. Dr. Hawkins observed from the audience, proud of the progress Sarah had made in their work together. The young woman who had once used emotional detachment as armor had learned to embrace vulnerability as strength, developing the emotional intelligence and interpersonal skills necessary for effective leadership. While challenges remained, Sarah now possessed the tools and self-awareness needed to continue growing and developing throughout her career. As Sarah accepted her completion certificate and the insignia that marked her transition to advanced special operations training, she carried with her lessons that extended far beyond military tactics and procedures. She had learned that healing required courage, that strength included the ability to ask for help, and that true leadership meant caring for others as deeply as she cared for the mission. The bruises had healed, but more importantly, the silence had been broken, replaced by a voice that could inspire others to achieve their own breakthroughs and transformations.